When women are going through perimenopause, menopause, and postmenopause, is it possible to experience a great sex life? What is up, sapiosexuals? Thank you for turning on Sex in South Beach with Dr. Sanjaya. So the sex situation we're getting into today is all about helping women who are perimenopausal, menopausal, or postmenopausal learn strategies to have a fulfilling, sensual sex life before and after the big change. I am super excited to have Dr. Shyama Matthews with us, the board certified ob-gyn. She does minimally invasive gynecological surgery, and she's also a certified menopause specialist for the North American Menopause Society. Thank you so much, Dr. Shyama, for joining us today. I'm so excited to have you here.
I'm so excited to be here. Thanks for having me, Dr. Sanjaya.
So when women are going through these changes, and I think they're real physiological changes, I can tell you I'm getting hotter by the day, okay? I call these my hot years, right? So is it even physiologically possible to have really good sex as we're transitioning?
Absolutely. And actually, I would venture as far as saying you could have better sex because as you're going into these years, there are a lot of aspects of your life that you don't have to worry about anymore. And now you can actually sort of reclaim that part of your life and that part of your body.
Right. I keep thinking about that. Like, yay, I'm not going to get pregnant. And then I have this fear like, oh my gosh, what if I get pregnant right now? No. Did you hear about these? My mom was 48 when she got pregnant. Not my mom, but I've heard other people say that.
Oh, yeah.
And then
it's
like,
still possible.
I think I was an accident. My mom was So it is possible to maybe even have a better sex life as women are going through this change. I know one of the biggest complaints that I hear about is lubrication. The body's ability to naturally lubricate when aroused definitely does change. So how do you tell patients to deal with this?
Sure. So that's probably one of the number one negative effects towards one's sexual life in this transition. So as our estrogen levels start dropping, the vagina is incredibly estrogen dependent. So that tissue changes dramatically. There's less lubrication, there's more irritation, and then also the layers of the tissue itself also thin. So that becomes really easy to injure and becomes very sensitive as well. So the very first thing when I talk about sexual pleasure with patients is sex comfortable? Like sex should not be painful, right? And that is usually one of the main things women say deter them, is that sex is painful. So very first thing is about addressing what physiologically, as you mentioned, what's going on with the tissue, right? So that lack of lubrication is one of the main things. So, and this is why I got involved with a company like Playground, is because their approach was to design a lubricant that is specifically formulated for the woman's body, for what our vagina needs. That's pH balance, good, clean products, no harsh chemicals, really allowing that lubrication just to be there to aid in what we're trying to do, which is have good sex. So correcting that painful sex part of it is going to be number one. So not only lubrication, but then also how the muscles are, detaching that fear around sex as well, because the tension that you sort of build up. So those two things are the first things I address with my patients for sure.
And let's say someone can get lubricated, their body is still naturally lubricating, but they have problems with desire and libido. It's hard for them to get aroused. And this is probably the most common issue that I hear from women over 30. What is your advice for women who just don't feel desire anymore?
So it's a really complex question because, you know the answer to this, right? Because it's not just physiology, it's psychology too, right? So it's a lot about, are they creating time and space and attention, prioritizing this in such a way that they're going to focus on their body and allow their body to have those responses. So that's part of it for sure. And then I find that, yes, there are some aspects of the hormonal changes that are going on as well. And you're right, you mentioned women in their 30s, because women will start having these things as they're going through life, like when they're pregnant, after having a baby, when they're being like when they're moms, or when they're going through career stress. Like, I mean, so many other aspects of our lives that affect our ability to enhance our sexual desire, or want to promote our sexual desire. So a lot of my advice is actually focusing on that side of things.
I wholeheartedly agree. One of the things I actually recommend to women often is role playing, because it kind of gets us out of our brain and we're in a character now, and a character that we think is sexy and that we think feels sexy. And of course, that character doesn't have the same concerns that,
Right.
we might have.
Right. That's
Think?
brilliant. That's a brilliant idea, because I do think that's part of it, right? I'm like, when you have a laundry list of things you're trying to get done in your day, like sex does not come on that list. So how the heck are you supposed to have desire? So I think that's a great piece of advice. I'll have to use it myself.
Absolutely.
Absolutely. I agree with that. And I think the other aspect of it too is, I think we all need good education on what's going on with our bodies at different points in our lives, right? Like after having a baby, what's going on down there? When you're in perimenopause and these hormone changes are happening, and like psychologically you're under a lot of stress. Like, so I often encourage my patients to bring in their partners to talk about these things, because then they can hear what's going on, and then what kind of changes and suggestions we're making together, and they're involved. It's great.
I love your perspective about lubrication, because you think lubrication is just as important as skincare. And I couldn't agree. It's like you put lotion on your skin every day to make sure it's moist and nourished and hydrated with the best nutrients that you can find. With lubricants, is it beyond just lubrication when you're having sex? What do you think about vaginal moisturizers and things like daily things women can do even when they're not having sex?
Yeah, I think those are excellent uses of products that can, again, as long as they're cleanly formulated, the idea behind them is that they're not trying to throw off the balance. Our vaginas are meant to be at a specific pH. You don't want to mess with that. They don't need to be, crazy complicated. They can sometimes be very simple. So I'm super into that. I think regular regimens, using lubricants every time, having a vaginal moisturizer that you're using on the regular. And in some postmenopausal women, I often will encourage even hormonal treatments that are prescription, but that can also help delivering some local estrogen to the tissue. So you're right. I agree. I think it's about taking care of that area of our bodies, just like we take care of everything else.
So let's talk about hormones, because you brought it up. And I think hormones is an important and somewhat controversial issue still to this day. I know when my mom was going through menopause in her earlier years, there were a couple of studies, very small research trials, that said hormone replacement therapy was bad for women. Basically, it increased cancer risk. But now, if you look at the wider body of research and we think about hormone replacement therapy, many studies today show that it can be more beneficial than it is risky. What's your perspective about hormone replacement therapy as women are going through the change?
I think that just like with any treatment, any medication, anything prescription, it's always individualized, right? Like, so it has to take into account what your personal risk factors might be. Now, taking that into account, there are great benefits to using hormone replacement therapy during this transition, not only with sort of the physiological changes, but also with relation to things like desire, with relations to things like stress management, anxiety. I mean, there's so many aspects to this. And then beyond that, bone protection, heart protection. I mean, there's a role for all of this. I think the controversies were there for a very long time. And unfortunately, there's a lot of misconception and fear around hormone replacement therapy. And I think the importance is seeking a provider who's comfortable discussing it, finding someone that's going to be able to weigh your risks and benefits to taking something like this and considering it as an option. It's not necessarily for everyone, but I do think it could be a great benefit.
I agree. I absolutely agree with you. When people are looking for products other than hormones, like lubricants or vaginal moisturizers, I know you're a big proponent of making sure that women are making informed choices and that you think that we should go for physician-approved products.
Well, it's more that there's thought put behind the product development, right? I mean, there are lubricants that are on the counter that are available over the counter that haven't changed in decades. decades, right? Science has changed over weeks and months. It advances, and let alone there are lubricants that have been available since our mothers were our age, our grandmothers were our age, sadly. And there's really nothing that's advanced about them. Nothing has changed about them. So now, thankfully, we're at a time where we can reclaim this importance of sexual wellness. And there are now products that are being developed that are really well thought out. And that's really where I think the importance lies.
I always tell people, I don't, be very careful with the warming and the tingling and the flavors. Try to go as clean as possible.
Right.
So when you're choosing sexual health products, specifically, particularly lubricants for something that's going to be going inside of you, tell us a little bit about Playground's products and why you think Playground is a good brand that women should be considering when we're looking for products.
So the first thing that I would say about lubricant products is knowing that what you can use and when, right? So there are silicone and water-based products that are safe when using a condom, and then there are oil-based products that are not safe when you can use a condom. So you have to be kind of mindful about that. The other things are, you're right, I think staying away from things like that are warming, that are tingly, I don't think that actually adds much to the experience. The Playground products that are available, we have clean products that have no scent to them, that are really just there meant to be lubricants. And then there are some gently scented products, because scent can also be part of that sensual experience, right? So some of that is also part of enhancing that experience. And it's, again, formulated in a way that it's not going to irritate, it's not going to make sex uncomfortable. And for example, things like, certain products and also certain times in our lives where we're more prone to things like UTIs and vaginal infections, we don't want to end up there. There's nothing like a sexual buzzkill than waking up with a UTI the next morning, right? So we want products that steer you away from that situation. And that's where I think the Playground products are really they're really mindful of that.
Now, that's a really good point, actually, UTIs, because that's another thing that does seem to increase with age in women. Anybody can do a Google search and find out that women going through perimenopause are at a greater risk for developing UTIs, and then postmenopause as well. So what is your recommendation to try to prevent and avoid? I always tell women, consider D-mannose as a regular supplement.
D-mannose is an excellent supplement. There are some people that believe in it and others that don't, but honestly, I've seen it work. I've seen it work in my patients time and time again as a great supplement to prevent and reduce the number of infections. But going down to the basics, like I said, it really comes back to avoiding friction, keeping the area clean, urinating afterwards to sort of flush out any bacteria, sort of basic principles related to vaginal health, which it becomes a little harder when you're in perimenopause and menopause, postmenopause. Again, when that tissue is more sensitive, the walls are weaker. So that's where, using a good lubricant, considering vaginal estrogen, these products that are going to help support that tissue and make it a little bit more comfortable.
At the medical school where I work, we have one pelvic floor therapist, and she works with our cancer center, and it's impossible for someone who does not have cancer to get into her. But I do believe I teach a yoga for better sex class that has a lot of pelvic floor work and Kegels involved in it, that women who also may not have the financial resources or be able to access a pelvic floor therapist, can they do these types of things on their own?
Absolutely. And there's actually some really great resources available online now. Some of these PTs have excellent social media approaches that you can access as well. You can use vaginal dilators to help expand the vaginal walls so that you can kind of accommodate bigger sizes, especially when you start tensing up. Doing that as an exercise to help stretch is really helpful. There's vaginal wands that can access the muscle groups that tighten. So there's a lot of different techniques that go beyond, actually being able to see a PT. But I think that approach is really important too.
Until today, I didn't even know there was the North American Menopause Society. It might be fruitful for someone who is approaching perimenopause or menopause to look for a provider who's a member. That would make perfect sense, right? You guys are providers who have taken some extra educational some sort of extra training
Correct.
or yes, in helping women make it through?
Yes. So the North American Menopause Society is basically focused on menopause. They release a publication regularly called Menopause. Their website is menopause.org. They have a provider listing. And to be a certified provider, to get your initial certification, you have to take an exam. And it's not easy. And then in order to maintain your certification, you have to maintain a certain number of credits every 2 years, specifically on this topic. So that means attending conferences, reading articles, staying up to date on what's available out there on this topic specifically. So if you find a provider that's certified, you can kind of be assured that they're sort of up to date, literally, on what's going on in this world of menopause and what options are available to you and be able to counsel you. And many OBGYNs are excellent clinicians in their own right for many other things, but this is an area that unfortunately a lot of people don't get focused training on. In the 4 years that we do our residency, we don't spend a lot of time on this. So to find a consultant that is specifically, willing to talk to you about this area is, I think.
That's why I'm so happy. It was a little over 40 years ago, maybe it's 50 years ago, when women were allowed to become physicians in the United States on a broad scale. And I think now that's why we have finally some female sexual health interventions and medications, because there's people like you now where there weren't for our parents. But I think that the security I find, if I were to pick a provider who's part of the North American Menopause Society, they're not going to be quoting a hormone study from 50 years ago saying, no, you can't do hormones because, it didn't work 50 years ago.
I think, in general as well, I mean, we talked a little bit about how little sexual education we get as medical professionals get. But I think it's important that you're able to comfortably talk about sex with your doctor. I mean, your doctor should be you should be open with your doctor about this topic. I have so many patients that start the conversation kind of hesitantly, and they're like, is this okay that we're talking? Is it okay if I ask you these questions? I don't want to waste your time. I'm like, no, it's not a waste of my time. I want to hear this. I want to know what's going on. It often precedes me asking the question, because I will bring it up in an open-ended fashion, like as part of a general wellness exam. But if a doctor's not willing to talk about it or feels kind of embarrassed or not well-versed in it, hopefully they're able to counsel you and guide you to someone who is. But there are ways and resources that you can find doctors that are willing to talk about it.
And I think that's really, really important, because right before the show, we were talking about a paper I just published, What Are Doctors Learning About Sex? And the answer was nothing. I remember when I was writing the introduction, I found research that said almost all doctors are uncomfortable approaching sexual health topics with their patients. So when you went to medical school, I know, and you focused specifically, your residency was in ob-gyn. So how much did you guys learn, not necessarily about ob-gyn in the way that the female body works, but how much did you learn about sexual pleasure, dare I say? Yeah, zero.
I think that's zero. And I mean, even in general, some of the topics like menopause weren't really very well covered either. Maybe a couple of lectures here and there. But it wasn't something that we learned in clinical practice, the way that we learned how to deliver a baby, or the way that we learned how to do a C-section, or to do certain surgeries like hysterectomies. Like menopause as a topic, hormone replacement therapy as a topic, sexual pleasure, very little coverage on that, unfortunately. So I think there needs to be a little bit of an overhaul on that front.
Yes, I wholeheartedly agree. Recently, I was asked this question, and I wanted to know, what is your opinion? Because we have women, clinically, there's one sexual health product that you can prescribe to patients. I'm talking about Addy, right? Mm-hmm. For women.
Actually, there's two.
There's two. Okay, I want to hear about the second one.
Okay.
And Addy is really focused on creating these feelings of desire in our brain, because most women are okay once they start having sex. It's the desire to want to have sex where the problem is. So I know where I work, Addy is not a highly prescribed drug. And I get asked about it all the time by clinicians. And One, I want to hear what your perspective is on Addie, and also tell us about the second one as well.
Sure. So when I'm having a conversation about, low desire, specifically, there are three kind of interventions, like treatment interventions that I can sometimes bring up, other than the ones that we talked about as far as like psychological and all of the other things, physical, comfort, etc. So Addie is one of them. It's an oral tablet that you take once a day. It is clinically shown, and there are studies that it does increase desire and then lead to more sexual events in the time frame that they studied. It was initially released with this silly like warning about like drinking on it and like how it would affect you if you were drinking on it, that it might make you more drunk or potentially, side effects related to that. It was really kind of crazy. And then if you read how the study was designed, I thought it was kind of nuts. They've since reduced that. They've gotten rid of that warning. But the problem is, I don't think they've really made a push on educating since then. So a lot of providers sort of, they kind of ruled it out in the beginning when it was first brought up. Because you have a glass of wine at dinner. That's part of the experience. It's part of the, part of date night. And then they're like, well, no, you can't do that. It's like, that doesn't really make sense. So anyway, that's been removed. So it is one option. That's the closest we've come to a oral form of like Viagra, like the little blue pill. When you want it, you take it right then. You have to take it every day. So you have to stay on it consistently. So that's the other downside for a lot of women, unfortunately. Right. That's one. The other medication that's available, FDA approved, is called Vyleesi. And that is something that you can use sort of in the moment, like when you want to potentially have more desire that night, date night, birthday, Valentine's Day, whatever, like for that specific moment, that special night, but it's an injectable.
So you inject yourself?
Yeah, you inject yourself. And it's a small bee sting, right. Not a very big injection, very easy to do for yourself. But that too is a little bit of a, whoa, wait, I have to inject myself before, I want to get in the mood. And I'm like, well, yeah, unfortunately, that's the closest again to the little blue pill that we got is an injection at the, before, but you can use it several times in a month. Once you take the shot, it lasts for a good 6 to 8 hours. So, for the evening, right. That's kind of a good approach. And I've had great results with that too, as far as patients using it. Two other caveats to this. Both medications were only tested in premenopausal women, which is ridiculous, but that's how the studies were designed. And they are interestingly non-hormonal. They're not related to hormone at all. So how they function has nothing to do with the hormone aspect of things, which I always thought was really interesting. Again, goes back into the idea of where does desire really arise? Then the third product, it's not FDA approved, but you can get it from compounding pharmacies, is topical testosterone. Right. So testosterone is one of the things that fluctuates and we know is related to our desire levels. Definitely we see that falling as we get into perimenopause, menopause, and other times of our life too, where hormones might fluctuate. So you can get a compounded formulation that you apply, and that can help with some of the arousal for that area as well. So that's another option that I'll present to patients as well.
Awesome. Yeah, I've heard a lot about testosterone, and I've heard good feedback on testosterone. And I want to remind everyone who's listening or watching that there's erection injections for men who can't take Viagra or Cialis. So I think that an injectable, actually, to me, it sounds very, very promising. Because I know about, basically men have a vagina that fell out. Right. Their vagina fell out. We all sort of have, we're similarly built down there. Do you inject it? Do you inject it in your, no. Where do you inject it?
No, it's regular injection. So you could do it. Yeah, you can do it. It's more of it's sub-Q. So kind of in your abdomen or upper leg, that kind of area.
Okay, cool. Yeah. This was a very, very helpful. I learned a lot in this conversation. I learned a lot, and I'm definitely going to check out Playground And for anybody who's into it, we're going to provide a discount code. You can look at it in the show notes, but we'll have a Dr. Shyama specific discount code so you can go to Playground too and know that I know we all want to go see her, but she is in New Jersey. So if you are in New Jersey, definitely try to make an appointment with Dr. Shyama Matthews. I would assume she has a line out the door. I know if she were in Miami, she would, because I would send every single person to her. But you can go to helloplayground.com and you can check out these products and know that they are Dr. Shyama Matthews approved. And they are lubricants and products that are really built for women's bodies through the lifespan, and with specific attention to thinning mucosal membranes, changes in lubrication production, and all of the different changes that are encompassed as we go through this phase where one day we might not be able to get pregnant again. Yay for Thank you so much. You guys know what time it is. It is time for your climax, where I give you 5 things to remember about women going through perimenopause, menopause, or postmenopause who want to enjoy a really fulfilling sex life. And I'm going to say 1, what we learned from Dr. Shyama is that hormone replacement therapy is not the worst evil of all times. And it actually may provide extreme benefit for women who are suffering as they're going through the change. 2, I love this. Painful sex no more. Mm-hmm. Pain and sex do not go together. So if you're having painful sex, bring it to your doctor's attention. And if your doctor isn't paying attention to you the way that you want, let's go into 3. Look for a doctor who is a member of the North American Menopause Society. These doctors have not only had to pass a really difficult exam in order to become members, but they also have to update their continuing education every 2 years. So they know about the latest advances in therapies that can help women have a really fulfilling sex life until the day that they're gone. So do it, do it, do it. 4, pelvic floor therapy. Mm-hmm. This is non-invasive. These are basically exercises to strengthen a female's pelvic floor, whether or not you've had a baby. Every pelvic floor on a female is going to go through changes over the lifespan. I think it's around 70% of women who are going to experience incontinence at some point in their life, and strengthening that pelvic floor can help you delay that or prevent it. Mm-hmm. And it's also really important to maintain a good feelings when you're having a sexual encounter. Squeeze. You want to be able to squeeze. You want to be able to feel the experience. When we talk about role playing, it's not faking it at all. That's the wrong. So don't fake it. Don't have pain. But you have the resources, and there are professionals who are around to help you develop a better sex life as you're going through the change. And last but definitely not least, check out helloplayground.com. And if you're a guy and you love a woman who's going through the change, that might be something you want to check out, mister. helloplayground.com. Nothing like giving your lover a nice care package that benefits the both of you. Thank you so much for checking us out today. Dr. Shyama, where can they find you? What are your socials?
So it's Dr. Matthews, GYN. And you can find me also at drmatthewsgyn.com, and on helloplayground.com. I'm there in a section that's called Ask Dr. Matthews, office hours with Dr. Matthews.
And I want to remind everyone, Dr. Shyama Matthews' name is spelled Matthews. 1 T in her Dr. Matthews. Okay. For your daily dose of Nookie knowledge, check me out on all the social media platforms. TikTok, LinkedIn, Instagram. I know you want to link up, so what are you waiting for? Thank you so much. I had so much fun chatting you up about how to have a great sex life until the day that you die. And I can't wait to do it again. Thank you for tuning into Sex in South Beach, where everyone comes for happier, healthier sex.
My Uber driver lost his mind the other day, but he blamed me. He said I smelled so good he became too excited to drive. This man actually pulled over to get himself together. And he refused to drive until I told him the name of my fragrance. Then he bought 3 bottles before driving again. I know Sen's body oil makes men crazy, but that Uber ride should be free.
Smell good, feel good. SenseBodyOil.com.